a part of the truth. So anybody have questions before we get started?
No questions.
Okie dokie. So there's my dog. That's all my stuff. The reason why I have these hydrangea is to show I'm a lot better at seeing things than I am in the abstract. My brain doesn't do very good with the abstract, didn't even before my stroke. So they are great when it comes to pH and how it affects them. If your soil is too acidic or too alkaline, the plant will die. But if the soil is a little bit what they call sweet or a little bit alkaline, the flowers of the hydrangea will be pink. And this is when it's changing. And it stays pink until it dies. If the soil is a little bit acidic, the flowers will be blue. Now, of course, we don't change colors whenever the pH changes in our body, but it affects us overall just like it does this plant. And too much one way or the other, and you die. And after this class, you'll understand even more why it's important to keep your pH in a very narrow amount. Our disclaimer, you're probably sick of it, so I'll just go past it. There has been so much misinformation about pH. I don't know if anybody has anybody else taken classes on pH before or read a book or anything? Well, I took several classes, many lectures. I read several books, and they all say something different. What you're going to get tonight is all the information I got from the books and everything, plus what I have found while working with pH and people for the last 36 years. Now I don't do very many people a year, but well, about 30 years ago, I was doing about 10 people a day. So there's a lot of people that I have worked over the years. I just show you what I did on Google when I typed in pH. They said that the pH is between 5.8, 5.6 to 7.9. It's like nobody agrees. 7.0 to 7.5. This is 6.29, which is very narrow, but it's not the right number, and so on. I have had people come to me that they're past clients who come back and say, I know I'm acidic. I can tell I'm acidic. Well, I've been doing my own pH for 36 years, and I do not know if I'm acidic or alkaline just by how I feel. I know that it's off. I can tell when it's off, but I don't know which direction it is. I don't think anybody can. The only way you can know for sure is to test your saliva and your urine pH. The best time to do it is first thing in the morning before you eat anything, drink, smoke, kiss somebody, anything. You know, when anything have touched your lips or your mouth. And I believe that you should have the first urine when you wake up, and we'll get into that a little bit later on. These are the strips that I really, really like from Nature Sunshine. They are in increments of 0.5. So this is 5.0, 5.5, 6.0, 6.5, and so on. The first ones I got were like 5, 6, 7, and that's too hard to read because it is so narrow. So I would get them in increments of 0.5 or less. The only thing is, the only ones I've seen that are less, and most of the other ones, are not plastic tipped. They're like a roll that you have to pick it up with your hand or tear it off with your hand. And the pH of your hand or the gloves you want to use or whatever can change the pH result. So I like these because there's plastic that you can touch. You pull it out of the top, and then you spit on the litmus paper, the yellow part right here. After you do that, you match it to the colors because it will change color. If it's this color, it's 5.5. If it's darker, it's 5.0. If it starts turning green, it's becoming more alkaline. Is there any questions about this?
No questions so far.
Okay. I think a part of the misunderstanding or misconception of pH started because of Dr. Otto Warburg. What he did was absolutely amazing. He's the first person who brought pH even to the recognition of people. They never did it before, and people didn't even really care about pH, but he did. Matter of fact, in 1931 and then again in 1946, he got the Nobel Peace Prize because he said that he proved that cancer cannot thrive in an alkaline medium. So what he did was amazing, but that statement that cancer can't thrive in an alkaline medium if you're alkaline is wrong. Matter of fact, the lady who got me into herbs, Carolyn Frankenberry, my sweet mentor, would always argue with me because I always tell her to get her pH straightened out. So I'm trying to drink water. Maybe my throat will be so bad. And she'd say, because she's always alkaline, 7.3. And she said, oh, Mary, 7.0 to 7.3, that's fine. That's what the books say. And I would argue with her. Well, not only wasn't it fine for her, but she got cancer 3 times and ended up succumbing to cancer. And I could not convince her that the 7.0 or 7.3 that she was at was any good for her body. I'm going to tell you a little bit about pH. If you've been in my class before, this might be a little repeat. I'm sorry about that. Neutral is 7. pH stands for potential of hydrogen. So the more hydrogen there is in fluids, the more alkaline it is. The less there is, the more acidic it is. So 1 would only have a few hydrogen molecules, while 14 would have a boatload. To correct your pH, people think, oh, I'm alkaline, so what I need to do is eat acidic foods. And that's not how it works. The average person cannot eat something very alkaline because it's a poison. Oven cleaner. You drink oven cleaner is very alkaline, but it'll poison you. It's not what it is outside of your body, the pH. It's what it is after it's gone through the digestive system and absorbed and what ash is left over. So these are supposed to be logs of wood. If you have a log, and down here like oak, I looked this up. Oak has a pH of around 12, piece of oak. If you burn the oak, what's left over is an ash, and the ash pH is around 4. So what a food is outside the body has nothing to do with what it's going to do to the pH of your body. Scientists have decided what the pHs are, and it will help us immensely. Your stomach acid should be very acidic, about 1.7. People are taking antacid like, was it Prilosec or something like that, or Tums or Rolaids to get rid of their stomach acid. And when you do, it takes it down really, really low, and it can't digest anymore. The stomach acid should be so acidic that it should be able to digest a razor blade, to digest the parasites in there, to kill them, to digest the food, the minerals, the vitamins. If it's not very acidic at 1.7, you don't digest fully. Now, this is a really good example, probably my favorite, of what pHs are. The pH of lemon juice outside of the body is a 2. And you think, oh man, that's really acidic. But when you drink lemon juice and it goes through the body, it leaves an alkalizing ash. So if you're very acidic, actually you can do lemon juice either way. But if you're very acidic, drinking lemons will actually help you become alkaline. Am I making this somewhat clear? Does anybody have a question about that?
No questions so far.
Okay. So I just put various things like vinegar. Vinegar helps you digest, so it's positive effect on your pH. Colas are not, like Coca-Cola and Pepsi-Cola and stuff like that. Tomatoes are good. Coffee is not good for you no matter what pH is. It's very acidic. It stays acidic through the body, and it causes problems. Your saliva should be, in your tears, in your urine, should be 6.4. Now I'll tell you in a minute how I know for a fact that's what it should be. Distilled water, as I said, should be 7. Your blood should be 7.1. Then baking soda is very high, 9. If your pH should be 6.4, drinking baking soda is not a smart idea. Matter of fact, I know you've probably heard this before, but my father, when he had an aneurysm removed, they had to replace the arteries from his heart, a quarter of an inch from his heart, the whole way down to his knees, because whenever they tried to splice in the titanium tubing, it was ripping. It wouldn't graft in. And they said, we got to test this. We had never seen this before. And when we went back to the follow-up to the doctor, he said, what do you drink? Do you use baking soda? Do you drink baking soda? My dad said, oh yeah, I have heartburn all the time. I drink baking soda. And they said, that is what destroyed your arteries. This too has been a source of this information. There was a doctor They cut somebody open, saw all this acid, catarrh, and cancer in their body. And he thought, I can't remove it all. I can't. So he flushed it out with baking soda and he sewed the guy back up. And the guy overcame his cancer. So they said, baking soda is great for cancer. But it was done one time and the body could adjust to it. And it took care of the acid at the time that the body could get a footing in doing it right. But if you drink it all the time, it doesn't do that. It destroys your arteries. I don't know what baking soda is twice on there. Okay, so the pH scale is a logarithmic scale. So people come to me and they say, oh, it should be 6.4. No problem, I'm a 6.0. My computer does that. I'm sorry, these marks. 6.0, and it should be 6.4. That's only fourth, not even a whole point. But I just did this before we came on class. A linear scale would be, well, first, they tell us that there's 10 units between 6.3 and 6.4. That's a lot. To fully understand the concept of it, the difference between 6.4 and 6.5, consider it being 10. Between 5.0 and 6.0, it would be 20. I mean, another 10. You add those two together and it'll be 20. 6.0 and 7.0 is another 10, so it would end up with 30. 7.0 and 8.0, you would end up with 40. So you add those units together. Logarithmic scale is times. So between 4.0 and 5.0 is 10 times, or 10 units. Between 4.0 and 6.0 is another 10 times, which is 100 units. Between 6.0 and 7.0 is another. Between 7.0 and 8.0 is another. So instead of adding these together, you times them. So first it would be 10 times. The next time is 100 times, 1,000, and 10,000. So the difference between 6.4 and 6.0 and 8.0 is 10,000, not 40. Does that make it clear on how important it is to get the right number of your pH? Did I say that in English?
Yes, you did, and people say yes, they understand.
Okay, so we're talking really important. I just did from 4 to 8 because the very lowest pH I've ever seen was a little girl that had a brain tumor, and her pH is 4.0. And the highest I've ever seen was an 8.0. So we're not going to go through all the other numbers. So when you're born to a woman who is balanced, their pH is balanced, and you're being fed nice, healthy breast milk from that mother, so her breast milk will be balanced, your pH should stay around 6.4, both your saliva and urine. If your mother's stressed and her pH, her milk is a little bit acidic, or if you, or if you're stressed as a baby, your pH is going to become acidic. The body's constantly trying to balance you back up. So what it will do is it will break down bone tissue, cell tissue, usually mucosal lining, and it will use the minerals in that to get rid of the pH imbalance, to get rid of the acid. And doing that, robbing your body of minerals, will bring the pH back up to where it should be. So if you have a little bit of acidic or a little pH problem, that's what happens. If it goes on and you don't take care of the pH imbalance, and we're going to talk about how to later on. I'm sorry, my computer's acting up. You'll become depleted. The body will say, okay, we robbed all the minerals we can from your back. If we do any more, there's going to be an injury. Or we can't take any more out of your digestive tract or intestines because it's going to damage it. So then it will ask the liver to produce pneumonia, and will bring the ammonia up. When the body has to do a ditch effort to protect you from something, it overcompensates for it. So ammonia is 11. If the liver produces ammonia and the ammonia gets in your bloodstream, of course it's going to go higher than 6.4. Then when your liver tuckers out, it says, I can't do that anymore. I can't produce any more ammonia. I just don't have what's in me, the health in me to do so. Then your pH will go way down below 5.0. And that's what happened to that little girl. So most people think, I have the pH imbalance this way, so I got to bring it this way. And that's not exactly what happens. It starts out here, and then it keeps going. It'll go up to here, and then it goes like this. Does that make sense?
Dr. Maria, we have a question. What are symptoms of high ammonia in the liver?
Well, actually, the ammonia doesn't really usually stick around the liver unless you're really, really sick. Usually you'll see it other places. You'll smell urine, or your sweat will smell like urine. I mean, smell like ammonia. If it gets really bad, if a person has ammonia in their bloodstream, it'll go to the brain and they'll get symptoms of dementia. Matter of fact, my mom one time, because I had taken a class on clinical trials, and the lady said, if you ever see somebody look like they go senile really quickly, it's because ammonia in their system. And my mom was sharp as a tack. She really was, until the day she died. But one day, my stepfather called me over. He said, Mom took a stroke. Come over quick. And I did. And my mom's picking things out of the air. I don't know what she was picking, but she was picking things out of the air. And we were talking to her, and she didn't know what in the world we were talking about. So we took her to the hospital. We thought she had a stroke. And they tested her, and they said, nope, no stroke. She didn't have a stroke. And the doctor came in, and he says, she just went senile. That happens at her age. I said, no, 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 no. You don't go from being sharp to being senile in a matter of a couple days or a couple hours even. And he said, so you just don't want to believe it, but she's senile. And then that thing came back to me. God lets you do things for a reason. And I think I took that class for a reason, that clinical trials class. I said, test your pH. And he said, we don't test pH. I said, test to see if she has a bladder infection, because a bladder infection will cause you to have ammonia. Or actually, if your urine is too alkaline, you'll probably get a bladder infection. So the doctor said, well, he's arguing with me. Did she have complaints of a bladder infection? I said, no, she didn't, but I still want you to test her. He didn't want to, and I said, do it. I got really angry. So he did, and probably about an hour later, the nurse came over and gave her shots. I said, what are they giving her shots for? She said, it's an antibiotic. I said, why are they giving her an antibiotic? She said, we found out she has a raging bladder infection because the ammonia went to the brain. So having a stroke can cause dementia all at one time. That's where my dementia came from. But if it happens real quick and it wasn't a stroke, it's probably ammonia. But the only way besides taking the test that I know is if you're senile or if you sweat or pee and it smells real like ammonia, really bad. That's why I really suggest everybody get the pH strips. I hope that answered your question.
And there's another question. How often do you drink lemon juice every day?
Depends how bad your pH is. If you wanted to, now I don't believe in using sugar, you know. If you're diabetic, you can't use a lot of honey. But when it comes just to lemon itself, you could drink lemon straight, as far as I know, 24 hours a day, 7 days of the week, and it not cause a problem. Nobody has messed up their pH by drinking too much lemon water in the last 36 years I've worked with this. But that's a great question. And the ammonia question too. I'm glad you brought that up, because I don't want anybody to end up in a nursing home merely because there's too much ammonia in their blood. Any other question?
That's it for now.
Okay. So if you are alkaline, 7.0, don't take calcium, because calcium is very alkaline and it will add to your body. And I want to bring this up here. Acid burns the tissues of your body. Alkalinity, slight alkalinity, poisons your body, but if it's really acidic, really alkaline, it will also burn. Like lye can burn. So you don't want to add to your alkalinity by taking a calcium. Nature's Sunshine used to have an acidic calcium, and I'm really upset that they quit using it. They had a calcium that would bring up the calcium reserve, but did not add to the alkalinity of the body. It was brilliant. So if anybody finds, I don't know, Joanne, have you ever found a calcium that is acidic?
Yeah, Daily Manufacturing has a calcium lactate, so which was the ingredient in the liquid calcium. So that one is what I use if someone has that issue.
Oh, great. Can you email that to me?
Sure.
So You still sell herbs, right?
Yes, ma'am.
Okay. So if anybody wants, if they're alkaline and they want to build up their calcium, contact Joanne. And I'll have her phone number and her email address at the end of the thing. So when your body uses the minerals, this is supposed to be minerals, calcium and minerals. When it gets too low, that's when the body will produce ammonia. So you want to bring this up. And I think calcium is the best way of doing it. So Joanne's calcium is what I suggest. I've never used it, but I know Joanne. I know she's smart. And what that will do is it will bring the calcium up so the body no longer has to use ammonia. It can use the calcium to neutralize to get rid of the acid. Any other questions about that?
No questions.
Okay. Now there's 5 different possible stages of a pH imbalance. This is when you're balanced, saliva and urine being 6.4. Sometimes your saliva will become alkaline because your liver has been kicking in. You're not using just minerals anymore. You'll never get alkaline unless your liver is producing ammonia. I had a friend who had something called raw passion. He ate only fruits or vegetables he could pick. Nothing else. And even he never become too alkaline. So whenever you get pneumonia, either in your urine or in your saliva, that's kind of stage 2. Usually I find out it's this one. Your saliva will be acidic and then your urine, your body will start producing ammonia and it's coming out of your urine. And then when that is tuckered out, the body can't get rid of enough ammonia. So you have ammonia coming out of both of your saliva and in your urine because there's so much. Then when the liver tuckers out, and to survive, it can't produce any more ammonia. I keep saying pneumonia, ammonia. Then both your saliva and your urine will become acidic, at least 6.0, many times below 5.0. So that's why the best thing to do is to get the liver out, having to produce it at all, and to bring your minerals up. And then if something comes to say you eat the wrong foods or something one day, your body can take care of it with what's inside of you. Does any of this make sense? Is this still English?
Still all good.
Okay. So the urine goes, whenever the pH goes through your kidneys, it's best to do it first thing in the morning. And if you read different books, they'll tell you different things. But you heal while you're sleeping at night. That's when the body will pull out acid or ammonia if it can, and when it will be using what it needs. So that is whenever it's doing its work. So the first urine is what I like, because chances are you take your urine 5 times a day, you'll get 5 different numbers. So the number I personally think is best to know is what your body's been doing all night when you're sleeping and it's been healing. But other books, I'm not saying the books are wrong. I just found that seems to work the best. Now, urine can bounce around, like I said, sometimes 5 times a day even. Like my pH is perfect this morning. I go out and I drive. I used to be able to drive. And a car pulls out in front of me. I think, oh, you rotten, lousy person, you. What's wrong with you? And that can make my body produce acid. If I'm out in a store and I'm really thirsty and I get a soda that's very acidic, that can mess it up. If it stays between 5.5 and 6.8, off and on. Okay, let me put it this way. If my pH is 5.5 tomorrow and 6.5 the next day, I'm not going to worry too much. I'm going to kind of average it out. Now, if it's always 5.5, you got a problem. If it's always 6.8, you got a problem. But it will bounce around because so many things happen to us in our lives. Any questions about urine?
Nope, nothing yet.
Okay. Probably my favorite book was Your Health, Your Choice by Dr. Ted Morter. He is a brilliant man, and he explained things so easy, which I like because my brain's kind of likes easy stuff. But your saliva and the fluid that's in your body is the same pH. He said after years of testing both, he's found that out to be true. Of course, you're not going to stick a needle in your arm and suck out some of the white blood cells to see what your pH is. So it's easy to spit on something, much easier. So say you got a couple cells in your body. Around the cells is a fluid, much like, does anybody ever retain water around their knees or in their hands? The bottom part of the legs. So fluid will fill up in between these cells all the time. The fluids pull nutrients into the cells. Other fluid will pull toxins out of the cells to be dumped through the kidney or through the bowel. Each cell has a membrane around it. Kind of like a baggie. If you have like a sandwich, something you put in the baggie to preserve it, well, there is a baggie around your cells. If your pH is 6.4, the baggie or the cell membrane will be exactly how thick it should be. If the pH is too high or too alkaline or too acidic, that will damage the cell, so the body will make this cell membrane thicker. Like if you have a pair of shoes and you buy a brand new pair of shoes and you wear them and they rub and you wear them long enough, you'll get a callus there. The body will overcompensate. The body lets you do its own thing. And if it's not if it's irritated in some way, it will try to fix it. And when it does, it over fixes it. It overcompensates for it. So the cell membrane will get thicker. When it does that, it's harder for the nutrients. Oops. Sorry about that. It's harder for the nutrients to get in. I am sorry. Harder for the nutrients to get in. And the toxins to get out. Does that make sense even though I screwed it up?
It does. And just going back to checking the pH, someone's asking, do you when you're doing the urine, do you pee a little and then test, or do you just start peeing? How do you do it?
I don't think it matters that much. If you want to squirt a little and then take it, you can. As long as you don't use lubricants and stuff like that that will come in the urine, it doesn't matter so much. But if you're kind of like, ha ha ha, with my boyfriend last night or husband last night, then yeah, I would probably pee a little bit first. Good question. I don't think I have ever had that question before. That person gets an apple or something as a prize.
Sherry, you get a gold star, and Alice got a gold star for her other question. So
All right. Good job, guys. Any other questions?
that's it for now.
Okay. One of the lectures I took on pH was by Joan Vandergriff. She was a senior national manager for Nature Sunshine. And she had a bunch of students, biology students at BYU, test to see what different cells of the body absorbs different nutrients. And they made her this chart. It wasn't this colorful. It was too hard to understand because people say, wait a minute, does this slime mean this or that? So I colored it in so you know what's what. It's only from 5.3 to 7.8, I think it was, something like that. I can't read it right now. But she found out that between 6.3 to 6.6, I hate my mouse doing that. Those squiggly lines are not my fault. It's a stupid mouse or something. I don't know. My computer does that. Iodine can be absorbed into the cells of the body. So your thyroid can absorb iodine. And I know this one, I don't know all of them firsthand, but I know this one is a fact. I remember this one lady came to me and she said she had thyroid problems. And I said, oh, thyroid activator is what I suggest. She said, no, I tried that for a year. It didn't do anything for me at all. And I had taken this class from Joan Vandergriff, and I said, well, let me test your pH. Her pH was, I think, 5.5, but it was way down here. And I said, well, you know what? Chances are your thyroid couldn't absorb it. So let's correct your pH and then try the exact same product. thyroid activator. And I even told her, I said, if it doesn't work, I'll pay you the money for it. So she called me after about a week of taking the thyroid activator, and she said, I think it's working. Probably about 3 months after the thyroid activator, she says, it is definitely working. This is amazing. And I've had other people find good results with their thyroid whenever their pH is between 6.3 and 6.6. And that would be their saliva pH. If your saliva is 6.0, you can only absorb nutrients from this out, yellow out. So sulfur, chloride, this stuff, but you cannot absorb chromium, so you can become insulin resistant, manganese, so you can have problems with hearing, you can have sounds in your ears, iron, cobalt, copper, zinc, germanium, selenium, molybdenum, they put it moly, but it's molybdenum, and silver. You can't absorb any of that. If you're too alkaline, you can't absorb it either. Some people are having a hard time with this chart, so I drew another chart. At 6.5 or 6.4 should be the number. At 6.5, you can absorb every vitamin and mineral that is on that chart. Every one. At 6.0, you can't absorb these ones from here up. At 5.5, you can absorb even more, and less. At 5.0, there's even more you cannot absorb. Then again, at 6.5, you can absorb them all. But the more alkaline you get, the less you can absorb. So either this chart or this chart. Does everybody understand how it affects the way you absorb nutrients? Well, I'm hoping so.
Yes,
I hear the noise.
we're getting yes, very interesting.
Okay, good. All right. Dick Williams had me put this on there, probably because I'm a fat chick. But they say acid causes weight gain. That's not really true. Acid keeps you from losing weight. If you have a lot of acid in your body, and the body stores places, it will store it in the joints. We'll get into that later on. In the tissues, and the body doesn't want to get rid of that acid because it will destroy the kidneys in your liver. I mean, kidneys, liver, and intestines. So it will slow down your metabolism so that it can hold on to the acid or the ammonia. So there's people that are like, well, whenever I started to gain weight, I ate an apple and a half a day, half an apple for breakfast, half an apple for lunch, half an apple for supper. I did that for 6 months. At the end of 6 months, I lost 5 pounds. So the body can hold on. It's not having your pH isn't the only thing, but it will definitely help you in losing weight. Any questions about that? And this is a self-portrait of me, by the way.
Going back to the absorption, someone said that it makes sense why she's not able to absorb zinc and selenium for her thyroid.
Yep. Very good. So you take your pH, anybody get pH strips, you take your pH for 3 days and send it to me. I'll help you know how to tweak it so you can get it rebalanced. And then, yes, whenever you take stuff, it will work so much better. Infinitely better. Okay, now I want to talk about cancer. I've gone to classes where they said acid feeds cancer. Then another person would say ammonia feeds cancer. Actually, neither one of those are right. I want to explain why cancer grows because you're acidic. Okay, so these are abnormal cells, tumors. The body's immune system, lymphocytes, go constantly checking things out, and they'll say, "Oh, we got cancer right here." Then it will commission, the T cells will do that, and it will commission the body to send lymphocytes to kill the cancer. And the lymphocyte goes in there, and it kills that thing. What it does is it uses enzymes. It will drag an enzyme with it. The enzyme will open up the cell wall, allowing the fluid to rush in, and it bursts, much like putting a balloon on a water hose. You turn it on, it'll get so big and it'll burst. That's how it busts up. That's how enzymes work when you digest. That's how enzymes work whenever you get rid of cancer or abnormal cells. Does everybody follow that part before I go to the next part?
Yes.
Okay. So you have another cancer cell. The lymphocyte starts coming up with an enzyme, but the fluid around the cell is acidic. The enzyme cannot work in acidic medium. The acid will kill the enzyme. So the enzyme cannot do anything bad to the cancer, get rid of the cancer. So usually another cancer cell will develop. If you stay acidic, whenever new enzymes are being sent, it still can't kill the cancer. And it gets bigger and bigger and bigger. And that's how cancer goes crazy in the body. I took a lecture one time where the guy said the average person probably gets cancer about 4 to 8 times in their life, but their body takes care of it without them ever even knowing it. But if your pH is off, then the cancer can keep growing. Another thing is I've been privileged to be able to work with people who overcome cancer. And one of the biggest things I do is say, we got to get your pH normal so you can absorb nutrients, you get rid of toxins, and you can use your enzymes to kill the cancer. The ones who stick really close to the diet to keep their pH what it should be, do well. I've had people overcome bone cancer, liver cancer. Probably the best bone cancer person she was told that she should bring her family home because she didn't have much longer to live. And she said, "Oh, they'll be here next week for Thanksgiving." And the doctor said, "You don't have until Thanksgiving. Have them come now." So she talked to a friend of mine who's into herbs, and we talked and we decided to change her pH and do all this stuff. 6 months later, she walked out. She could walk out to the store. I think it was a year later, she was back to work. I talked to her about 20 years after the fact, and she was still alive. What the doctors were doing for her wouldn't have worked, I don't think. But if she hadn't changed her pH and wasn't so religiously stringent to changing her pH, I don't think the herbs would work. I can almost tell whether or not I'm going to overcome cancer through herbs when they come to me. They're the ones that are willing to give up their coffee or anything they have to get rid of the cancer. So we all understand the cancer connection. And if you are double acid, you can almost bet on getting cancer because there's no way the body can protect you anymore. Okay, I have the picture of these eyes. Some people, if the person asked about how can you tell if you have ammonia? Well, one of it is by looking the eyeballs. Come on, mouse. Okay, so here's a kind of large capillaries, but these are just little capillaries that are supposed to be in the eye. But the eye looks kind of pink. The eye shouldn't be pink. In sclerology, when we teach sclerology, it tells you, you can tell if the eye is a little bit pinkish, that means that they say you're alkaline. I have found that if you're too acidic, it also happens. So I put that here because there's room to put pictures. But look in your eyes, and if your eyes kind of look a little pinkish, but not necessarily big blood vessels, you probably have a pH imbalance. Okay. From that chart, your pH of your saliva should be between 6.3 and 6.6 because that's what the cells need to be. That's when the body can use lymphocytes to get rid of cancer. That's when you can absorb all the nutrients, the vitamins, and the minerals that your body needs. As I said before, your urine can bounce around a little bit. As long as it doesn't constantly stay acidic or constantly stay alkaline, it's not as worrisome. Your skin should be slightly acidic, and that is to keep parasites, bacteria, viruses from getting into the body. I know a lot of people will use some kind of hand sanitizer to keep healthy. Some hand sanitizers are alkaline, which doesn't make sense to me whatsoever. Because the acid is what's supposed to kill the viruses. Now, I wouldn't put battery acid on my hands. If your pH of your body is what it should be, the skin will be too. Your tears should be around 6.5. And those are easy to take. Just keep your eye open for a while, and if it starts watering, just test your saliva pH. But if tears pH. If the saliva is balanced, the tears will be too. Now, breast milk was told to me by Miriam Drewis. She was a midwife for 50 years. She has since passed away. But she told us that breast milk should be an 8.0. She was a Mennonite, and they didn't drink coffee, and they didn't have a lot of stress in her life and stuff like that. And she said, "Oh, all my ladies, they get their milk at 8.0. The kids do wonderful." I looked it up, and it's just like Googling pH in general. They'll have all different numbers. But Marion was a pretty smart lady, and she really knew her stuff, so I feel pretty comfortable with 7 to 8. Water, as I said should be 7.0. Reverse osmosis water, I think, is the best water because there's so much junk in our water: fluoride, chemicals, pesticides, jet fuel, all kinds of stuff. RO water, they take out the minerals and a little bit more oxygen gets in. So RO water is slightly acidic. I don't think it causes a problem at all. And your blood should be 7.41. Even though you won't die unless it's between 7.35 and 7.45. This is another thing that pH does. If your blood is too acidic and it goes through the arteries, it will irritate the acid or the alkalinity, because something too alkaline can burn too. It causes damage and burns a little bit. It irritates the arteries. So what the body does is it takes cholesterol and it puts like a callus in the arteries. And they call that plaque. When I had my stroke, I baffled the doctors. They said, "You shouldn't have a stroke." But I did because my kidneys are bad. But they tested, they gave me an MRI or CAT scan, I don't know, something. They put me in a machine and they took a picture of my head. And they said, the doctor said, "Wow, you only have a mild buildup in your arteries." So it's kind of impressive, actually. Well, that's because I kept my pH normal. I had a cousin, and probably heard the story before, I'm sorry to repeat, but I had a cousin who had quadruple bypass after a heart attack, and her pH was really bad. When they tested her cholesterol, I'm sorry, I goofed that up. She took a heart attack. They put her on statin drugs and took her cholesterol down to 170. Then, probably about 6 months later, she was rushed to the hospital and they had to do a quadruple bypass. And she said, "I don't understand it. I'm on cholesterol, a lot of cholesterol medicine. My cholesterol's 170. They said, "Well, we're going to have to lower it." So they lowered it down to 130. She became nervous. She became forgetful, dizzy, lose her balance. All these side effects because her cholesterol was so low. And she died of a massive heart attack and stroke. She had both a stroke afterwards and had a massive heart attack and died. When they did an autopsy, I'm sorry, she didn't have the stroke. If I don't teach this and think about it a lot, I forget. I apologize for that. It was a heart attack she took. She didn't take a stroke. Whenever they did the autopsy on there, the doctor said those shunts that they put in, the catheterization, and not the catheterization, the angioplasty they did for her had closed. It had plaque closed. And her cholesterol, total cholesterol was 130. But she had severe rheumatoid arthritis, osteoporosis. Her joints just ached her like crazy. She also, like me, couldn't wear jewelry because every jewelry, like your earrings and stuff like that, your ears would peel and her jewelry would discolor from the pH imbalance. Okay, we're almost done. So this is what causes acid. The number one things is emotions. If you're in a bad relationship with a tyrant, it'd be best to either get counseling or find a way that you're not under all that tension. Whenever I got married the second time, it was not good. And I went to the eye doctor and I said, there's something wrong with my glasses. Look at them. And he said, well, I'll take them to the tech. And he came back, he said, you got acid on them. They're etched because of acid. Well, at that time, I would cry. Some of it would get on my eyeglasses, and it was acidic enough to cause etching. If that's the case out of self-preservation, and it's not my ex-husband's fault necessarily, but I'm divorced because I wouldn't have lived much longer if I wouldn't have. I also couldn't be nice to him anymore because I've had so much. Not that you want to know all that, but bad emotions. A bad job, take your pH, and it's affecting your pH so bad, your job, that it's acidic all the time. You're endangering your life. It'd be best to find a better job. Medications mess up your pH in all different directions. It makes it too acidic or it makes it too alkaline, especially pain medicines. There are herbs that can get you out of pain most of the time. There are patches. Joanne, you want to tell them about the patches for pain patches?
Sure. Actually, LifeWave makes several different ones that are good because there is IceWave that helps with any kind of discomfort. There is Eon that helps with inflammation. There's glutathione that helps with detoxing. Eon's also good for stress. So those are my favorite as far as working with alongside the pH.
Okay. And I like the pain patches. You put the pain patches on, and literally within a couple seconds, the pain goes from 9 to 2. It's like a switch. It turns off the pain if you get in the right order. I mean, the right place. You have to place them properly or they don't work. But there's other things that you can do that you shouldn't need pain pills. I probably take 2 Aleve a year. And that's usually because I'm just too lazy. I want to do something, and it comes in an inconvenient moment. Now, don't stop your medication because you need certain medications. If you're on heart medication and go, whoop, I don't want to mess up my pH. Well, you can take a heart attack. I can't stop my pH. I can't stop my high blood pressure medicine because I'm going to take a stroke. Don't be stubborn like me. But there's medications like the craziest one I ever known is Rogaine. People will take medication that is toxic to get rid of, to keep their hair so their hair doesn't fall out. That's just insane to me. What you eat and drink is very, very important. Coffee is horrible for you. And I hate that they say that there are antioxidants in coffee. And I finally won an argument with somebody when they said that. I said, what if they said cocaine is healthy for people? Would you take cocaine? If cocaine had antioxidants, would you take cocaine? And she said, of course not. I said, well, coffee's just as bad. Tea, now we're not talking herbal teas. We're talking black or orange pekoe tea, green tea, and white tea. They call it white teas. They're all the same kind of tea bags. But like chamomile tea or peach passion or lemon zinger or something like that is fine. And soda. And not just the caffeine, although that's not good for you. The soda in general can chew away at your teeth. There was a YouTube thing that had a film that had what they had teeth and they swished soda around it for a couple days, and you could see it just made them fall apart. Milk, cheese, ice cream, and yogurt for at least some people is no good. Milk, yogurt is not really good because of the calcium magnesium. We won't get into that for anybody, but there's some blood types that are, they can get away with it. O blood type, you can't. So I suggest people stay away from those doing a lot of that. And for O types, don't do any at all. Sugar is very acidic. Sugar is bad for you. And although I used to be addicted to sugar so bad, I have probably only had sugar maybe 10 times in the last 10 years, or since I went on my diet. So you can live without it. It's hard at first, but now it's not that big of a deal. But it took probably about 2 years before it wasn't a big deal. You got to make sure you have good digestion. If you burp, fart, or bloat, that means you're not digesting your food. So the food will ferment, producing gas. And when it produces gas, it also produces acid. It's best to stay away from processed foods. Better to eat foods that are raw, vegetables, raw fruits. Not meat, but raw vegetables, raw fruits. Even if you cook vegetables, it breaks down the enzymes and you don't digest it as well, and it doesn't do as much for your pH balance. And if you're going to juice something like oranges or something like that, if you drink it, well, that's not even really good for you, but pomegranates, you juice pomegranates, you drink it right away, that's good for you. If you let the enzymes die after a few hours of squeezing it, it's no longer good for you. Okay, this is how it happened for me. It happens for different people. The body will rob the minerals out of your body different places. It knows what it needs. If I was a lumberjack, chances are it wouldn't have robbed it from my lower back. But I'm not, and I sit around a lot because I was an iridologist, and you don't stand much of the iridology. So I started getting a weak lower back. The body robbed calcium out of my lower back to correct the pH. Matter of fact, the the dietary people, I can't remember, but the Association of Diet, they even did a study that showed that osteoporosis is aggravated by calcium because of the acid. Then it will take the lubrication out of your joints, so your joints get stiff or crack. If you walk up the steps, you're click, click, click. You can also get uric acid in your joints, in your knees. The first place you see kidney problems is in your knees. The uric acid will settle in the knees. And then, of course, the longest toe of your foot usually gets it too. If you wake up in the morning and you have to blow your nose or clear your throat like I was doing before because I have a cold, that is probably because of a pH imbalance. The body will water it down with mucus. If you have to blow your nose every morning and clear your throat every morning, your pH isn't exactly what it should be. Allergies, sinus problems is because you're breathing acid out through the respiratory system, and that acid is too acidic, so it can't handle any allergens or pollen that comes in. My son-in-law used to have allergies all year long, terrible allergies, and now he just has it in the fall because he's correct his pH. Heartburn, you'll take the mucosal lining out of the esophagus. Acid reflux. Out of the intestines, you get colitis, Crohn's, irritable bowel. Some psoriasis, although psoriasis is usually liver, some people get psoriasis is from a pH imbalance. The body uses sodium, not salt, but sodium, calcium, potassium, and magnesium to the most. Those are the most first four minerals the body uses. This is kind of like Theodore Brody, I think his name is. I can't remember his name. Dr. Brody came up with a pH chart of foods. And this is the chart. So this is acidic. Come on. And this is alkaline. If fruit is sour strawberries are acidic. Sweet strawberries are alkaline. And a lot of that has to do with if they ripen out in the sun or if they're gassed to ripen. And speaking, I was going to bring this up when I said about the milk for babies. People use cow's milk in their formula. That's bad. Soy milk is very acidic. Goat's milk is the least acidic. So if you have to use artificial milk for your loved one, use that. Okay, Joanne has an alkalizing calcium. If you're acidic, you can use Skilda Strength. Marshmallow root is really good for the kidneys and the gallbladder. Slippery elm is good for the digestive tract. The esophagus is good for heartburn, building up your esophagus. A lot of people end up getting bladder infections, again, because it's alkaline. Their urine is alkaline. And it doesn't kill off the, excuse me. Sorry about that. It doesn't kill off the bacteria. So you can drink cranberry juice if you're alkaline. Test your pH. If you're alkaline and you have a bladder infection, you know why. And cranberry juice will help. If you have a bladder infection and you take your urine pH and it's acidic, cranberry juice will actually irritate the bladder. That's why it doesn't always work. Yeah, I don't use this for skin. That's the last place you see it. Okay, now to pull acid out of the body. Cat's claw is amazing. They used to call it Indogado. It will actually pull acid and dump it into the bowel to be excreted. So unless you have colitis or Crohn's, I would use cat's claw to get rid of your acid. Does Nature's Sunshine have joint support anymore, Joanne?
I'm pretty sure they still do.
Okay. Joint support or yucca helps. Yeah, I would do that instead of cat's claw if you can't tolerate the cat's claw. And lemons are good anytime. Okay, there wasn't a lot of questions. Of course, probably you don't want me to go off in tangents. In general,
Sherry has a question she wanted to ask. Sherry, you want to go ahead? Sherry?
I made her fall asleep. I was boring.
You hear me now?
Yep, there you go.
I had to unmute myself for some reason. I think I hit it. Hi, Mary.
Hi, how you doing, Sherry? Long time no see.
I know, and it's been a long time since I've worked with this, and I just have a question that I've stumbled across. If you back up a couple slides to show that alkaline and the acid, right there is good.
Okay.
Okay, I just want to review this because I have kind of forgotten a few things. So if you're acidic, which would be the first 3 rows, you would want to take an alkaline food, correct?
Okay, very good question. I'm so glad you brought that up. I would eat, excuse me, 80% of my diet alkaline, no matter what my pH is. Because it will give you the minerals without causing the acid. but blueberries are very acidic. And I changed the chart. Dr. Brody's chart's different. He puts acidic, the alkaline food in this column and the acidic in this column. But I thought people they were getting goofed up.
That's what's happening to me. Yes.
So I try to make it consistent. So, but let's say your pH is 5.0. I would eat all these kind of foods only.
In the alkaline categories, correct?
Right. Yeah. Sorry.
Okay.
That side. And so always make sure I would do 80% of this all the time. And if you're too alkaline, I would still do that because these foods are alkaline, but they're not like 8 or 9 alkalinity. Their alkalinity is just a little bit.
Okay.
Like I said, that Ken who does Raw Passion, even though all he eats, all summer long, all he eats is fruits. Nothing else. Doesn't drink anything else. He's never become alkaline.
Okay.
So it's acidic foods you have to kind of stay away from. That's only about 20%.
Okay. Okay, I think that cleared that up. I haven't done this in a while and I was getting mixed up which was which.
Well, that's because I changed it on you too. Sorry about that. Well, people were saying, well, I thought you said acids over here. And so I did from 0 to 11 to 14. So I did it. So it'd be consistent.
Okay, thank you.
Mm-hmm.
And someone's asking, they say that they find doing the saliva test a bit messy. So they put the test strip on a paper towel and then spit on that. Would that mess up the reading or is that okay?
You can put it on the paper towel and spit on and lay your pH strip on the paper towel and just spit on it. But I wouldn't put it on the paper towel and then touch the litmus paper to it because paper has a pH too. Does that make sense? But what I do is I usually give people something to pull under their chin and I'll just say, let the water drip down, spit drip down. And some people actually spit in a stainless steel spoon and test it from that. Good question. Any other questions?
That is it. Okay, she said she'll use a spoon. Going once, going twice. Any other questions?
Yeah, you can ask questions about other things too. It doesn't just have to be about pH.
Someone said you mentioned a book.
If you could tell me a little bit more.
The author of Your Health, Your Choice.
Oh, Dr. Ted Morter. Wait a second. And it's Ted Morter Sr. Ted Morter Jr. wrote a book and it stinks. And the other book called Alkalize or Die is by Theodore Brody. And actually, I'm writing a book on pH. So in about a month, if you write to me, I will send you a manuscript via email of the book I'm writing. And remember, I took a stroke, so I'm not very articulate. Not that I ever was articulate, but it's not very good. But since you don't find it in any other books, because actually, Your Health, Your Choice by Dr. Ted Morter is the only book I found to be accurate. Although I've took a class on reams, REAMS. They're the most accurate. They're even more accurate than Ted Morter's book. But you usually have to pay a couple $1,000s for the class. And I'm a cheap human being.
I believe the book by Dr. Ted Morter Sr. is out of print because I don't see it anywhere, just the son's book.
Ah, his son probably did that.
Probably. Sounds like something he would do. And someone's asking, can acid cause thyroid nodules?
Yep. It causes nodules in your knee, on your lung. Yep, it can. Because there's abnormal cells and the pH keeps the body from bringing the enzymes to break up the abnormal cell. Now, I'm not saying it's the only cause, like certain toxins can cause it too, but it can. And it can keep the body from being able to get rid of it.
And can these nodules cause trouble swallowing?
If they get big enough, they can. Another thing that can cause a problem with swallowing is a diverticulum. What happens, your esophagus is a muscle the whole way down. So if you chew once, bite into something and swallow it without chewing it up really good, you can stretch that muscle out and you get like little pockets in there. And then it can fill up with stuff. So that can help problem with swallowing too. I have a problem with swallowing and singing and talking since my stroke because it paralyzed part of my throat. So it's not the only cause of swallowing. Also, thyroid, if your thyroid's swollen, you have a inner goiter, they call it. There's an outer goiter, you usually can see those, but you can get an inner goiter and that can help problems with swallowing. Probably more than you wanted to know, isn't it? Has your doctor, looked over you and told you a reason why you had swallowing? You know you have a nodule or you just think that's what it is?
They found it on an ultrasound.
Yep, it can. Test your pH. Anybody wants their pH tested for 3 days and they email me to my email? That's Joanne's email. My email, yeah, it's right here. Email me at marysherbs1@gmail.com and I'll help you. Correct your pH. And if your pH would stay normal for long enough, that nodule could go away. I don't teach classes all the time anymore, mostly because people are probably sick of hearing me teach classes, but I wanted to talk about the logarithmic scale, and that's why I'm doing this again, so I can put it on YouTube. And I forgot to record it, didn't I? Fart.
I'm recording it. Don't worry.
Oh, good. Thank you so much, Joanne. See, I can't do anything without you. But if anybody wants to learn iridology, scleroology, or my class on natural health professionals, where you could go out and be a natural health professional and help other people, I teach them for free. You just let me know when you want to do them and we can do them.
She says after a 3-day test, her acidic levels have been high.
Okay, well, that's one of the things I would do. I try to bring it high in number or high in acid. What were the numbers? Give me a number. Because some people will say high and they mean the number is high, and some people mean they're high in acid.
I can't see if you want to retype it.
While you're retyping, let me say this. I am so glad that you guys let me teach this class tonight. I know I did a really mess up job, and I apologize for that, him hawing around. It's been so long since I did, I kind of got out of the rhythm of it. Plus, I don't feel good. I'm sick. But I enjoyed it. And if any class you guys want, you get 5 people together, and I'll teach you a class anytime you want.
Okay. She said she's going to test for 3 days and then she'll send it to you. In the past, the acid has been high in the past.
Okay. Yeah, you do that. Anybody wants to do that. Although I'm retired and I don't work anywhere anymore, I can do anything I can do to help people. I'm more than willing to do that. And if I don't know something because of my dementia, which isn't as bad as it used to be, I'll tell you. I don't know. I won't try to fudge it.
Someone said they would like to see a class about between the difference of stress and anxiety.
Okay, email that to me, because if not, brain fart, squirrel, whatever. I'll forget about it. But yeah, I can do that.
Ooh, that would be exciting, especially if we add German New Medicine or they changed the name, whatever it's called now. I just want to say that with pH too, if I may, Dr. Murray talked about emotions being, stress and emotions. So there's an entire emotional detox system. And if that is not working properly, all of that stays in there and builds up and just kind of festers and causes more and more and more acid. So it's not only important to work on the physical aspects, but also the emotional, the mental aspects of your health as well.
Mm-hmm. Emotions have a lot to do with, not everything, but a lot to do with what's going on with your body. And then here's Joanne's stuff. She has, tell them about your podcast. I always forget to listen to it, but she has Kick Butt podcasts. They are just, you're still doing them, right?
I am. I took a little bit of a break, just because of the classes, but it's a podcast actually started with Dr. Mary, 2 years ago. So it's called Herbal Remedies Experts. You can find it on Apple and Spotify and Amazon. And it's as I said, the earlier episodes, you'll hear both of us on there. There is one on there about pH as well, kind of a sum up of what, it's a half an hour, so quick sum up of this 2 hours that we've been here today, and just different topics on your health and how to decode it and how to help.
Okay, cool. Joanne has learned so much. Do you guys know Karen Kahn? She was an Olympic skater. She's even taken classes and knows her personally. They rub elbows. I'm so impressed with that.
I know, I did fangirl when I met her in person. So- but yeah, it's been wonderful. I mean, Dr. Mary gave me the base for everything. I wouldn't have even met Dr. Karen if it wasn't because of Dr. Mary. And then but she does a lot with Chinese medicine, acupressure, German new medicine, emotion code, body code. So it's just another piece of the puzzle in figuring out what's wrong with us or how to best have our health, I should say.
Yep. Okay, well, I hope you guys have a wonderful 2026. And anytime I can help you in any way, shape, or form, let me know. And you know what, Joanne? Because of my dementia, I can't think of a joke about your email. I don't know. I can't end the class. How can I end the class? Help me,
Oh no,
Joanne.
now I'm really worried. Now I'm starting to worry.
Yeah, I always teased her about her pH being her email being so long.
Well, if it helps, my website is Natural Wellness Info. That's a lot shorter, so you won't get stressed out and have acidic pH trying to type in my email. How about that?
There you go. Perfect. We can end with that. So you all take care and thank you so much, Joanne. You're such a sweetheart
Oh,
for
my
doing this.
pleasure. Thank you.
So no more questions?
No more that I see.
Thanks, Mary. Thanks, Joanne.
Thank you,
Oh, you're
Sherry.
more
Good
than
to
welcome.
have you here.
Yeah, it
Thank you.
was. Okay, take care, everybody. Good night.
Night, everyone.